Hi, I'm Dr. Sheila Vidal. I offer ACT-based, trauma-informed guidance to help you better understand your mind and navigate stress with clarity and confidence. If you happen to be dealing with one of life's challenges right now, you're in the right place. Today, we're talking about ACT therapy for anxiety, how it works, why it helps, and what it looks like in therapy sessions. Before we begin, this is educational, it's not therapy, and not a substitute for professional care. If you're in crisis or feel unsafe, please contact your local emergency services or crisis line in your area. If you already know the basics of therapy, here's the core idea we're building from. ACT helps you reduce anxiety's control by changing your relationship to anxiety, not by trying to force anxiety to disappear. The outcome we're aiming for is psychological flexibility. That means being able to notice thoughts and feelings, make room for them, and still take action in the direction of what matters to you. A lot of people come to ACT after they've tried to think their way out of anxiety, calm their way out of anxiety, and it works until it doesn't. Because anxiety has a way of shifting target. If your mind decides this situation is dangerous, it will keep creating reasons to avoid, over-prepare, seek reassurance, scan for threats, or stay stuck in mental problem solving. That can look like constant worry, panic symptoms, social anxiety, perfectionism, or even a quiet type of anxiety, where you seem functional on the outside, but on the inside, you're drained and exhausted. Why fighting anxiety often backfires. The more you try to get rid of anxious thoughts and feelings, the louder they get. You tell yourself, stop overthinking, calm down, this shouldn't be happening. And instead of relief, your mind pushes back harder. From an ACT perspective, this is a human adaptive outcome, not your identity. It's how the human nervous system learns under threat. Here's the paradox, though. The more we fight anxiety, the more we train our nervous system to treat it like an emergency we have to escape. You feel anxiety and your mind says, this can't be here. You avoid, you escape, you over-prepare, check, control, or mentally replay. Anxiety may subside temporarily, and then your brain learns avoidance worked. So the next time anxiety shows up, it gets louder. ACT is designed to interrupt that loop, not by arguing with anxiety, but by shifting your stance toward it. Instead of, how do I get rid of this? We move toward, how do I make room for this and still live my life? That offers a very different kind of freedom. The ACT model is often shown in a 6-part framework called the ACT Hexaflex. It gives you a simple map of the 6 interrelated processes ACT used to build psychological flexibility. These are not rigid steps. They work together and you move among them depending on what anxiety is doing in your life. Let me walk you through them using anxiety examples you'll recognize. First is acceptance. Despite the word acceptance, ACT is not about liking anxiety, wanting it, or resigning yourself to the pain of ruminating anxious thoughts. Acceptance here means temporary acceptance of distressing thoughts and feelings and continuing to get up, dress up, show up for values-aligned behaviors. ACT is about learning how to make room for those distressing thoughts and feelings you experience, the ones you can't fully control. It's about changing your relationship to anxious thoughts and sensations, not to see them as you doing something wrong or failing to be better. That is an adaptive part of the human condition. And to acknowledge distress and still take meaningful action in your life. The goal isn't to never feel anxious again. The goal is psychological flexibility. In practice, for anxiety, acceptance often means learning to notice sensations like tightness, heat, nausea, adrenaline, dread, and letting them be present without adding a second layer of struggle or resistance. A lot of anxiety suffering is not just the first wave of fear. It's a second wave of, I can't handle this. This shouldn't be happening. It'll never end. Acceptance helps you drop that second wave of struggle. Second, cognitive diffusion. Anxiety is fueled by thoughts that arrive like warnings. What if I fail? What if I have a panic attack? What if I lose control? Or everyone is judging me? When you're fused with these thoughts, they feel like facts, and your body responds as if they are facts. Diffusion helps you to step back and see thoughts as thoughts, not because thoughts are meaningless, but because they're not always accurate and they don't have to run the show. In sessions, I might have you practice something like adding, I'm having the thought that, before every worry statement. Or we might label the mind's pattern. There's a catastrophe story again. Or there's a certainty-seeking mind again. Believe it or not, that small shift creates space between stimulus and response. And space equals choice. A classic diffusion practice you may have heard is leaves on a stream. You imagine placing each anxious thought on top of a leaf and watching it float past down a stream. The goal is to not force thoughts away. The goal is to practice noticing thoughts. They come and they go, and you don't have to grab them, wrestle them down, or build your whole life around them. Over time, anxious thoughts tend to have less behavioral control, even if they still show up. Third is present moment awareness or mindfulness. Anxiety lives in the future. It's a future-oriented fear. It pulls you into what if. Mindfulness brings you back to what is currently. In ACT, mindfulness is not just relaxation. It's attention training. It's learning to notice what happens in your body, your mind, what's happening in the room, and returning again and again to the present moment, especially when anxiety tries to hijack you. Sometimes in session, this is as short as a minute. Sometimes it's a practice of naming 5 things you see, feeling your feet on the ground, noticing your breath, noticing a color in the room. Not to erase anxiety, but to anchor yourself while anxiety is present. Fourth is self as context. This one can sound abstract, but it's powerful for anxiety. Anxiety often pulls you into an identity. I'm an anxious person, I'm fragile, life overwhelms me, or something is wrong with me. Self as context is the part of you that can notice anxiety without being defined by it. You're not your thoughts, you're not your sensations, you're the person noticing them. When this clicks, people often describe a shift like, I still feel anxious sometimes, but it doesn't scare me in the same way because it's not all of who I am. So it doesn't have to stop me from doing what matters. Fifth is values clarification. This is where ACT becomes deeply motivating, especially for people who feel stuck. Anxiety tends to shrink life. It quietly negotiates you out of things like relationships, opportunities, travel, leadership, intimacy, creativity, health, or even play. Values brings your life back into the frame. Values are not goals. Values are qualities of action. They're directions, not destinations. For example, being a present parent, being courageous or connected, being competent or being authentic, or taking care of your health. When values are clear, we stop asking, how do I feel less anxious before I live? And we start asking, what do I want my life to stand for, even with anxiety along for the ride? Sixth is committed action. This is where you translate values into actionable behaviors in realistic steps. And for anxiety, that often includes exposure, but with a different aim. Traditional exposure therapy often focuses on habituation, reducing fear through repetition. ACT uses exposure in the service of values. The question becomes, what is a small step that I'm willing to take toward what matters while practicing making room for anxiety? You're not proving that you can eliminate fear. You're proving that you can live while fear is present. And that changes everything. Does ACT work for anxiety? If you're hearing these processes and thinking, okay, does ACT actually work? The research is strong. Meta-analyses and clinical trials show that ACT can produce meaningful reductions in anxiety symptoms across anxiety presentations. And the outcomes are comparable to established treatments like cognitive behavior therapy, CBT. But what I really want to emphasize here is not just symptom scores. ACT targets the patterns that keep anxiety going: experiential avoidance, the struggle with internal experience, and the narrowing of life around fear. I've worked with many people who continue to experience anxiety, yet they're now showing up for what matters to them. I've seen clients travel by air after decades of avoidance and move into healthy, intimate relationships after years of staying guarded. Anxiety didn't disappear, but their lives expanded. When avoidance drops, flexibility rises. People usually don't just feel better, they function better, and they re-enter life. What ACT looks like in therapy sessions. Now let's talk about what ACT looks like when you're actually doing it in therapy, because this is where people often wonder, what is this going to feel like? Is this structured? What will I be doing? In my work, ACT is collaborative and it's paced. From the beginning, we clarify what you're struggling with, what patterns anxiety has pulled you into, and what outcomes you actually care about. We set expectations together. ACT is not about forcing you to disclose painful material before you're ready, especially if trauma is part of your anxiety. We prioritize safety and stabilization, and we work in the present in a way that respects your nervous system. In sessions, you can expect brief mindfulness and acceptance practices, not as performance, not as do it perfectly, but as experiments. We might practice noticing a sensation of anxiety in the body and describing it without judgment, like tight throat, fluttering chest, warm face, and then breathing while letting it be there. Not to make it disappear, but to build the skill of staying present and engaging while anxiety exists. You can also expect diffusion work. That's practical. We work with specific thoughts that showed up during the week, and we practice loosening the grip. Sometimes that looks like labeling, sometimes imagery, sometimes it's even humor. Sometimes it's like repeating a word until it becomes a sound instead of a perceived threat. The aim is always the same: less fusion and more choice, meaning making that stays practical. ACT also involves a different kind of meaning making than traditional talk therapy. We do talk, we absolutely explore your experiences, but instead of spending the entire session analyzing the content of every worry, we pay close attention to your relationship with that worry. What did your mind say? What did your body do? What did you avoid? What did you sacrifice in that moment? What mattered to you? And what would it look like to respond from your values, even in a small way? People often describe ACT as both practical and deeply personal, because the work is always connected to your real life. Between sessions, there's often home practice. In ACT, I frame it as life experiments. It might be practicing a mindfulness skill for 2 minutes a day. It might be journaling with the statement, I'm having the thought that, before worry. It might be taking one values-based step you've been avoiding and then observing what showed up internally while you did it. The goal is not perfect compliance. It's actively learning what got in the way, what helped. What did you discover about your mind and your capacity? If you ever felt discouraged because anxiety flares up when you start approaching what you avoid, I want to normalize something. Sometimes anxiety can feel more intense at first. That doesn't mean therapy is failing. It often means you're moving out of avoidance and your nervous system is adjusting. With good pacing, clear consent, and collaborative planning, we can keep the work challenging enough to create change, but not so overwhelming that you shut down. I want to close by giving you a simple way to hold ACT for anxiety in your mind. Imagine anxiety as a monster in a tug of war. If you pull harder, it pulls harder, and you get exhausted. ACT is the moment that you consider dropping the rope altogether. Dropping the rope doesn't mean the monster vanishes. It means you stop organizing your life around that fight. You turn back toward your life, toward your values, toward your relationships, your work, your health, your purpose. Anxiety can still be present, but it's no longer the director. If you want a deeper explanation of everything we talked about today, including techniques, examples, and the ACT Hexaflex framework, I've written a full detailed article on this topic. You can find it on my website under the blog titled ACT Therapy for Anxiety, Complete Guide to Techniques, Benefits, and How It Works. It expands on the tools we covered here and includes additional insights that may help you pace anxiety with more clarity and confidence. And if you're in California or Virginia and you're looking for ACT-informed anxiety therapy, I offer telehealth, and I also offer limited in-person sessions in Folsom, California by appointment. Thank you for spending this time with me. If this video supported you today, I hope you'll check back in for more ACT-led, trauma-informed psychoeducation with me, Dr. Sheila Vidal of Next Mission Recovery Psychology. I'll talk with you in the next video.